we do cover anything. So you should, according to the blueprint, your 240 test is pretty much just the same test that you had, the 230 test. It's going to be a very similar test. The only thing that might differ is your like the number of infusion type questions you get asked. You might get asked one more heparin infusion question and one fewer insulin infusion question, but they're both solved the same way. So if you got that correct last semester, you should be fine going into this semester. You've already seen the heparin type questions where the bolus and the calculating an infusion rate. You've done reconstitutions now for several semesters. So I always start off any of the 240 reviews that I do, whether we're at Allegheny campus or with Boyce. I just ask you guys what you would like to see or work on. I don't have a separate review sheet. I just will defer to the 230 study guide that was created by a Boyce student a couple semesters ago. And just we can go from there. And if you have other questions or any of the questions on here you're just not quite sure how to work through or want to see work through again, just let me know. And you can unmute and let me know, or you can just type into the chat, whatever's convenient for you. All right. Yeah, no, perfect. That's a good place to start with. We can look at the heparin bolus dose questions, and we have some good ones here. And I'll even create one that's different than what is listed, and then that way it'll be an additional practice. So what I'm going to do is I'm actually going to save this as 23 fall. So if you go into, you should have access to the OneDrive folder. It's the link that says click here for practice tests. It'll be updated with this. This sheet will all look the same, but we'll do the bolus doses, and I'll add them in here. All right. Sorry, I'm just double checking where some of these things are. All right. Here we go. All right. So what I'm going to do is I'm just going to go ahead and delete this. So first of all, when you do, I don't know exactly how it's going to show up on your test, like what the bolus dose specifically looks like, but you're going to be following a weight-based protocol that's going to account for the patient's weight in kilograms, and then you're going to make calculations based off of that information. So I guess I can't clear that out. Okay. All right. So what I'm going to do is I'm going to make some adjustments to the way the heparin bolus looks here. So again, this will be labeled as 23 fall dosage calc 230 study guide. It's in the Boyce 230 folder. I probably could just move it to a 240 folder, but it's already being saved in that area, so I'm just going to leave it be. The one thing I'm going to do is we're just going to change the patient's weight. Let's just say they're at 220 pounds. That way we're creating basically a different scenario here. Now, one of the things that I'll mention to you is this 80 units per kilogram body weight and the 18 units per kilogram per hour. Those seem to be very standard for the weight-based protocol, or what you could also argue and just call your order. Okay. Oh, okay. So someone was asking if the video will be available on Blackboard. It will. I don't have access to your Blackboard, so I post it onto my YouTube channel, and so you'll see it posted on YouTube. That would have also been a link that you would have received in your in the link with the Zoom link. Then it said click here for practice tests, and then click here for Dr. Rad's YouTube channel. That's where I'll post it. I'll try and post it in the Boyce, or at least in the 240 review playlist. So you'll see that up there. I'll upload it today. So the 18 units per kilogram per hour, the 80 units per kilogram body weight, that's the standard. So if you do a Google search for weight-based heparin protocol, or even just heparin protocol, you're going to see those units being described. Really, the only thing that changes is the patient's weight. Okay. Even your available, the 25,000 units and 250 milliliters half normal saline, and the bolus dosage strength of 1,000 units per milliliter, that also seems to be a consistent or a constant when it comes to the weight-based protocols. And so this is going to ask two questions. It's going to ask you to calculate the bolus, and it's going to ask you to calculate the infusion rate. So you might get a question where you see both questions stated, or you might get it where it's just the one question stated. So what I'm going to do is I'm actually going to do a page break here. All right. So everything's in the same document area. All right. So let's go ahead and work through this, and then I'll show you the variations that come from this. So at Allegheny campus, both these questions, part A and part B, are part of the same question. So if this was question 14, it would be 14A and B. You need to answer both A and B and need to get both A and B correct to get credit for that one question. Saying that if you miss part A or miss part B or miss both A and B, you've only missed one question. So, but hopefully after I show you what we're doing here, you won't miss anything. So the first thing we got to do is account for the patient's weight. Can't do it, keep it in pounds. We've got to convert it to kilograms. So 220 divided by 2.2 is 100 kilograms. Then I'm going to use that patient's weight, 100 kilograms, and I'm going to apply it to my order, which tells me I'm supposed to give them 80 units per kilogram. $80 times 100, I believe, is 8,000. So 8,000 units. Now the question says how many milliliters to administer. If it asked how many units to administer, we'd be done, but it didn't ask that. It asked how many milliliters. So then that's where we're going to have to use our bolus dose information in order to convert units to milliliters. One milliliter is equivalent to 1,000 units. And so your answer for this would just be 8 milliliters. The second part of this would be then looking at what you would program into your infusion pump. So the infusion pump is going to involve utilizing obviously their IV. And then with heparin, remember what we're trying to do is trying to prevent them from prematurely clotting, but we're also want to make sure we're not overdoing it and causing a bleeding situation. right? So the patient has two concerns: clotting, throwing clots, or bleeding out, because both things can happen if they get mismanaged on their heparin. So using the patient's weight, same patient, same weight, 100 kilograms. This time we're going to use the order that says 18 units per kilogram per hour. And the reason you know to use that is because you're looking for the infusion rate. And infusion rates, and sometimes they get called drip rates, even though you're not technically doing drops, like there's no drop factor involved. But what would tell you that you're doing that is the fact that you're looking for a rate. So that's how you know you're going to use the units per kilogram per hour. It's weight based. So, and I think I'm assuming you guys also get the same or similar type of pediatric class that they do at Allegheny campus, where you do a lot of weight-based calculations, because that's when it really counts, when you have your little guys and gals and their little weights, and you want to make sure pediatrically they're not giving them too much of a medication. So 100 times 18 gives you 1,800 or 1,800. Sorry, my 8 is disjointed here. This is units per hour. Again, we don't want units per hour. It tells me we're looking for milliliters per hour. If they don't give you that example, or if they give you, if they don't give you that example, or they don't tell you milliliters per hour, and you're like trying to calculate this, really the only way you would know that you're doing a drop rate, where you would be calculating drops per minute, they would need to give you some sort of indication of the tubing involved. So that they either tell you the drop factor would be like 20 drops per milliliter, or they would say you're using microtubing. But from what I've seen with the weight-based calculations and the heparin protocols, you're always calculating milliliters per hour. I have not seen that deviate. That doesn't necessarily mean you wouldn't see that differently, but I'm just letting you know, just in case you do see something different, just to kind of pay attention to that. But I don't think you're going to have an issue with that. So we're trying to convert units to milliliters, and we're going to have to use our other available. So in this question, you have two availables. One's a bolus and one's your IV. Okay. So 250 ml, 25,000 units. And then you're going to get 18 mil per hour. If you're doing this and you get something like 14.65, milliliters per hour, round that to 14.7. That's typically what you're asked to do in a true clinical setting. You may not even be able to program it to that decimal point, but for the math purposes, they ask you to round to your nearest tenth. I just want to double check. There's a question here. They give us a question for ml per hour. Do we convert the minutes to hours? Oh, yes. That is correct. Yeah. So when you're doing, if they, like, let's say it was, I'll use your example, 100 milliliters to be infused over 30 minutes, you're still going to convert that to milliliters per hour. And then you would program into the pump. There's two ways to do that. You can multiply by 60, and that would be converted to minutes, or you could say 100 divided by 0.5 hours, because it's a half an hour, and then you would program into the infusion pump 200 milliliters per hour. You're welcome. The variations associated with this is, we might see some changes. Like this is a different question, still dealing with a heparin infusion, but this time instead of a 250 milliliter bag, it's 25,000 units. So this is probably not a weight based a true weight-based calculation. It's just a different approach, or a different available. And but they still are asking you to calculate the rate of infusion. Again, if they don't tell you ml per hour, but they're giving you mLs, they're giving you units per hour. They don't want units per hour. They want milliliters per hour. So I worked this problem out the same way I did up there. I did 75 times the 18, which gives us 1,350. Then I eliminated units, and I was left with ml per hour. So if you use dimensional analysis, a lot of this stuff, already makes sense to you. If you don't, it's fine as long as you get the routine down. If you're getting the same answer I'm getting, you're doing it right. Okay. So there's no one right way to answer these questions, at least in my opinion. For this next question here, because you might see a variation where they look at the patient's APTT, and remember what that is. That's their clotting time, right? So if they're taking too long to clot, that's a problem. If they're clotting too quickly, that's a problem. And so you're trying to fine tune that range. So you might be making adjustments, which is why you look at the APTT. So in this, it tells you that if they have an APTT of 55, which is the time, 55 seconds, that you're supposed to increase your infusion rate by 2 units per kilogram per hour. Now, if we're basing it off of the standard weight-based heparin protocol, the initial was 18. Okay, but they usually have to tell you what the initial was, so that way you can make changes to it. So it says here your patient is currently on an infusion at 18 units per kilogram per hour. So you need to increase it by 2, which is why if you see beside there, I wrote 20 units per kilogram per hour, because 18 plus 2 is 20. So you either increase it by 2, decrease it by 2, increase it by 4, decrease it by 4, whatever it tells you to do, that's what you do, and that's what you base your calculations off of. Now, in this question, I'm assuming that they're talking about the same 75 kilogram patient. It wasn't clear here, but it doesn't really matter. You just, whatever the patient's weight is in kilograms, you multiply it by 20. The other thing that we have to keep in mind, and again, this was an assumption, that this IV bag also went with this. This is the same patient. So if you're wondering like where I'm getting some of these numbers from, I just looked at the one above it. Okay.
So
No, go ahead.
I don't know if maybe every campus is different, but I don't know.
There is definitely some nuance with the campuses. My guess is that you would not have done this last semester, except you would have been introduced to it during pediatrics, because when you're calculating a safe range, and they usually give you the high end, the low end, and the high end for calculating whether or not it's safe. That's essentially you're doing a titration type of question. And like where I'm getting that from is like where it tells you, like down here where 15 to 200 micrograms, so there's a range, and then you're calculating the end range, and so the low end and then the high end. And I'm assuming you did that in pediatrics, where you had to know like whether or not the order was safe. Is that something you guys did?
I don't recall doing that, to be honest, unless
Okay.
it totally disappeared out of my brain, but I don't ever remember doing that like on an exam.
Okay. And so then again, that might be just something like Allegheny campus does. If you, I think I have my, so just in case if you're interested, I'm pretty sure I have my pediatric notes. It's probably in the Allegheny campus folder on the OneDrive. You're welcome to look at those. You won't need them for this. I was just making an assumption that you had had some exposure to when they talk about the titration type questions. So, all right, so let's look at a couple of these examples and go through them, and then see what we can get to do. So, from what I've seen with these titration questions, is that they are it's a lot of like converting, and then you're getting frustrated and realizing that's all this is just more conversions. Um, so like we start off with one rate here, 5 micrograms per minute, and they're asking you to move to a different flow rate, milliliters per hour. And so that's what we're going to try and work through and figure out here. So it says you're preparing, your patient is on a nitroglycerin drip at 5 mics per minute. Nitroglycerin is mixed at 25 milligrams in a 250 milliliter bottle. And then it gives us a concentration of 100 micrograms per milliliter. And then it says, what is the flow rate? So when I see questions like this to me looks exactly like an infusion, like units per hour to milliliters per hour. It looks exactly the same to me. And so what I see is I'm going from one flow rate to another flow rate. So I'm just converting units. So I'm going to show you like what I would do for this. You may end up solving this in a different way than I do. Some people like to start off with the milliliters. I usually just start off with the rate that's already listed. So what I'm going to do is I'm going to take that 5 micrograms per minute. And what I'm going to do is I'm going to start making some conversions. The first conversion I'm going to do is I'm just going to go ahead and account for and get rid of micrograms and convert it to milliliters. So 100 micrograms, 1 milliliter. And so what I've done is I've now eliminated and put this into milliliters per minute. But what do we want? We want milliliters per hour, right? So before I do any other calculations, I'm just going to go ahead and add in and make that conversion. 60 minutes, 1 hour. And then what I'm going to do is I'm going to multiply across the top, divide by the bottom. So 5 times 60 is 300 divided by 100. And I'm going to get 3 milliliters per hour. I will say that this is the easier of the three. I think there's 3 titration like questions that are listed here. But if you just look at nitroglycerin drip like you would a heparin drip or an insulin drip, for lack of a better term, this is essentially what we're talking about. That's why I said when I look at this, I just see flow rate to flow rate, and they're just using different units. If you haven't tried 26, go ahead and do that one. Try and follow the same procedure that I just did with 25, and just type in your answer in the chat. So if you and treat it fresh. So if you already have it answered on your sheet, just get a blank sheet and then just try doing it from scratch. And I'm not going to confirm or deny the answers that are starting to come in. I'm just I'm going to wait and see until we get a couple answers, assuming some of you are playing along. All right, so let's work through this. So the 6 milliliters per hour is the correct answer. And if you're wondering how in the heck do we get there, so there's another little extra piece of information that needs to be accounted for. The order is in micrograms per minute, or the original flow rate is in micrograms per minute, but your available is in milligrams. So you need to convert that, and you can do that, first, do it last. You can really do it whenever you want. I'm going to show you the slow dimensional analysis way, but you can do it any way you like that seems to be appropriate for you. So I'm going to take my 20 micrograms per minute. Then I'm going to make a conversion factor from micrograms to milligrams. 1 milligram is 1,000 micrograms. So if you got 6,000 milliliters per hour, you skip this step. Okay. So if you're wondering, like, oh, where do you get that from? So now we're in milligrams per minute. Now I can get rid of milligrams and convert that to ml. So 50 milligrams, 250 ml. And then last but not least, because we don't want milliliters per minute, we want milliliters per hour, 60 minutes in an hour. And I apologize that my handwriting is not so great here. And then after you do all those calculations, you eliminate all your units. 20 times 250 times 60 divided by 1,000 divided by 50, and you're going to get 6 milliliters per hour. All right. Then I'm pretty sure this is the last one of these. Yeah. So what I did here is this is another type of nitroglycerin titration situation. And they're giving you in this scenario, this is a true type of titration type examples where they're starting low and then they're working high. So they're basically trying to build up as they're trying to lower the blood pressure. So you can see it starts off at 15 micrograms per minute, and then it's going to ramp up to 200 micrograms per minute. And so the question is, we want to convert that from micrograms per minute to milliliters per hour, and then that's what you're going to set on your infusion pump. So what I did is I took the low range, 15 micrograms per minute, and the high range, 200 micrograms per minute. So all we're basically doing here is we're starting with a low rate, and then we're working up towards a high rate. And then I imagine it would just increase in certain intervals. I don't know to what interval. I guess that depends on the blood pressure readings as well. So I took my 15 micrograms per minute. Then I used, oh, okay, where'd that 200 micrograms come from? I better double check some things here. I'm wondering if I changed an answer here because I don't know where that 200 micrograms came from, because it should be 50 milligrams. So let me revisit this, because I don't know if I may have just changed the variables and then forgot, but let's do it fresh since it's not looking correct. That was weird. All right, so based off of the data that's listed here, we have two rates, right? We have a 15 micrograms per minute, and we have, oh, okay, I see what I did. Okay, that's okay. 15 micrograms per minute, and then I have 200 micrograms per minute. Okay. And what we're going to do is we're just going to convert both of those. So we're basically doing the same thing we did in the previous two problems, but you're going to do 2 and 1. All right. So step 1 is we got to convert micrograms to milligrams because my available is in milligrams, which is why I recommend doing that. So I'm going to do both steps are going to be exactly the same. 1,000 micrograms, 1 milligram. Same thing here. Then I'm going to convert milligrams to milliliters, and I'm going to use the information I have here. So that's 50 milligrams and 250 ml. And then I got to make sure I can allot for the time. So 60 minutes per hour, 60 minutes per hour. Again, if you're doing this different than I am, like you are like chopping it up or you're making some conversions beforehand, as long as you're getting the same answer, we're all doing the same thing. Okay. Just giving you a little bit of peace of mind as far as that's concerned. If you're sitting there wondering, like, do I have to write all these things out? No, there's more than one way to get the right answer. I'm just showing you a way that I can visually represent what's going on via dimensional analysis. You can use that or not. Okay. So for the top number, I'm going to take 15 times 250 times 60 divided by 1,000 divided by 50. And I'm still going to get the same answer. So I must have reduced the to get to the 200 milligrams. But so I still get the same answer, 4.5 milliliters per hour. So let's see if the top number or the high range is the same. So 200 times 250 times 60 divided by 1,000 divided by 50, and then again 60 milliliters per hour. And like I said before, what we're doing is we're titrating our dose of our nitroglycerin from 4.5 mil per hour to 60 mil per hour. And hopefully now seeing that, it kind of demystifies what you're doing. And hope if you do see a question like this, hopefully you'll be able to solve it just fine.
So Mr. Rad, I actually got 60 mLs per hour for the second one, but for the first one, I got 45, not 4.5.
Okay, so let me just
I
double
don't know
check.
what I did wrong.
All right, so you may have divided by 100 instead of 1,000. So try your calculations again. So multiply all across the top, divide by 1,000, divide by 50.
So what I did was I converted the 15 micrograms to milligrams. So I got 0.15 milligrams. And I like to do the order over half. So I did 0.15 milligrams divided by 50 milligrams. And then I took that times 250 mLs. And I got 0.75. And then I times 0.75 times 60 minutes. If that makes sense.
It does. So where you went wrong is if you're converting micrograms to milligrams, it would be 0.015.
Oh,
You
okay.
divide by 1,000.
That's where I were. Thank you.
So because then if you have what you told me 45 milliliters per hour would be if it was 150 micrograms and then 200 micrograms. So then the 0.15, 0.2 would make sense in that respect, but you needed one more zero in front of your one.
Makes sense. Thank you.
Yeah, you're welcome.
I probably know how to do it. I just need a refresher.
Sure. Yeah, and like I said, your insulin infusion is the same thing. You're going to do the exact same thing as your heparin infusion. So I will sometimes the way I do it, I'll maybe it's a little bit different in you. I don't agree that it's beneficial to do the what's it called? To do ordered over have when it comes to flow rate type questions. I think sometimes things get flip-flopped inappropriately, but if you're getting the right answer, you're doing it correct, your setup is correct, so I'm not going to change anything. I'm just letting you know just to be careful and make sure you're getting consistent answers. So and that was directed towards anybody, not just you who asked the question. So all right, let me find, here we go. So it looks like we only got one good question here. So let's take a look at this here. So as I mentioned before, when I am doing an infusion type question, what I see, regardless of whether it's insulin, heparin, and now we've looked at nitroglycerin, what I'm paying attention to and what I'm suggesting you just pay attention to is we're just doing a conversion. We're going from one type of flow rate to another type of flow rate. So here we're going from units per hour to, and it says what should you set the infusion pump at. If it doesn't give you like tubing information, then what they're looking for is milliliters per hour. We have to make that assumption, even though you don't ever want to assume, especially in a clinical setting, but that's what you're doing on the math test. Our available is the 125 units of insulin and 250 ml. And so we're going to use that as our conversion factor. So again, you might do this differently than I'm about to show you, but I'm going to start with my 6 units per hour. I'm going to eliminate units with my 250 ml. Before I do any math, I just cross out my units and make sure I'm left with what I'm looking for, which is ml per hour. I take 6 times 250 divided by 125, and I'm going to get 12 milliliters per hour. If you go to the Allegheny campus folder and look at their 240, the practice sets or the practice tests that are there, there's some more of these insulin infusion type questions. And then that way you can kind of see, and the structure is the same. It's just going from units per hour to milliliters per hour. But if you need to see some additional practice, that's where they are.
A minute.
Oh, absolutely. If I can find one, hold on. Here we go. So for flow rate questions, this is actually a good example because there's some extra information that you don't need to know, as well as some somewhat confusing information. So I'm going to try and navigate what's being shown here. So if it ever asks you what is the flow rate and it doesn't indicate units, which is common with the types of questions you're probably used to seeing at Boyce campus, you're either thinking ml per hour or drops per minute. Now, what will usually be a good indicator that it's drops per minute is they'll give you the drop factor. It'll say the drop factor is 20. So when you know that a drop factor is involved, then you know that you're most likely calculating a drop rate. So you need two pieces of information to calculate the drop rate. You need the flow rate and you need the drop factor. Both those things give us the drop rate. Your drop rate is going to be drops per minute. Your drop factor is going to be drops per milliliter. And basically it just means like what a drop factor is 20, that just means that when that tubing releases 20 drops of a liquid, that 20 drops is equivalent to 1 milliliter. And then we need a flow rate. A lot of times the flow rate's ml per hour, but it could also be ml per minute, at least from the standpoint of the problem. If it's in milliliters per hour, you just got to remember to convert hours to minutes. If it's already in minutes, don't change anything. Just leave it alone. Now, so this question says gentamicin 60 milligrams in 50 milliliters, dextrose 5% water over 15 minutes every 6 hours with a drop factor of 20. So what is the extra information? Remember what I said is you need two things to answer this question: flow rate and drop factor. We don't care about the strength of the medication when we're calculating the flow rate. Obviously, we care about the strength and making sure it's the right medication from a clinical perspective. But when we're calculating rate, we don't care about what it is. We just care about how it's flowing. So the example I always use is if you're taking a minivan or a sports car to Kennywood, when you're driving there, you're probably going the same rate of speed regardless of what type of vehicle you're driving there. All right, so we have a volume of 50 milliliters. We have a time of 15 minutes. Now, this 6 hours is also extra information because it's going to be infusing over 15 minutes, and then every 6 hours is just indicating that you're either reevaluating after that, or after you run it for 15 minutes, then wait 6 hours, run it for 15 minutes, wait 6 hours. So the 6 hours is more of like a BID or Q6H. It's more about when you are running the order. All right, so 50 mil for 15 minutes times your drop factor, which is given to you, 20 drops per mil. We eliminate milliliters. 50 times 20 is 1,000 divided by 15. And we're going to get 66.6 repeating. You can't give somebody a partial drop. So you would answer this question as a whole number. You would round to the nearest whole number, 67 drops per minute. And then I will say, if you need some more, want to see more examples of drop factors, again, if you go to the 240 practice for Allegheny campus, there's a lot of drop factor questions that you can look at, as well as other types of flow rate questions. Some of these are repeated, meaning you'll see them repeated like they are here on the 230 study guide. But a lot of them are, I've added some over the semesters, even since this was created. So this tends to be the standard example of a reconstitution type question, where you'll see like the label, and you won't you'll know you're dealing with a reconstitution because it tells you it's an intramuscular order. So when we look at our order, so most likely you're not going to get a question that includes, all of this is probably not going to be included. You'll probably see this, your image, and then a question, and it might even just say, how much would you administer? So it may not even tell you how many milliliters would you administer. But if you don't know what you're administering, like capsules, tablets, milliliters, the fact that it's intramuscular is your clue that we're dealing with an ml type of medication. So milliliters, intramuscular. Okay. So when you look at your label, if this was a typical suspension, oral suspension, it would say something like 125 milligrams per 5 ml. So it would tell you, you would know how to find and solve for milliliters. But on the label itself, it doesn't tell you that. It just says 500 milligrams. That's your clue that you're dealing with one of these reconstitutions, and that you need to look over at the directions on the label. And so what you're going to be looking for is where it tells you what it's adding to the powder. So it tells you it adds 2 milliliters of sterile water. The total volume becomes 2.2 milliliters. But what you're really looking for is this right here. The concentration after they've added the water to the vial becomes 225 milligrams per milliliter. That's your strength. So depending on what your order is, you're just going to take, so for this one, it's the 375 milligrams. I converted grams to milligrams, divided by the 225 milligrams times your quantity. And then you get 1.6 repeating, but your answer is 1.7. Round that to 1.7 milliliters. But I imagine at this point in 240, you've looked at a lot of labels and you have a good idea of how to navigate those. But if you're looking through this review or even going into the 240, this is what I was saying. Like in this Omnicef, it's an oral suspension. It's 125 milligrams per 5 ml. If it's an oral suspension, if it's a liquid, you know that you're delivering it as milliliters. In the event that it doesn't tell you or ask you how many milliliters will you administer, you at least know that. And then if it's an injectable, right, it's milliliters. You can't inject powder or tablets. Even if you don't like the patient, you can't do that. Okay. A lot of these are suspensions. So this is 20 milligrams or 10 milligrams per milliliter. I'm just showing you the labels. You can look at those as well. Or sometimes they'll just give you the label information. All right. I'm going to go ahead and put into